NPR published an article detailing the percent increase in premiums for health insurance. They said Blue Cross Blue Shield of Tennessee was granted a 62% rate hike. In Minnesota, officials announced that premiums for 7 insurers on the individual market would be rising 50 to 67%. These unaccountable hikes will affect consumers making over the $47,520 subsidy limit, or those who didn't receive insurance through their employer. The cost of health insurance is forcing consumers to pay over $10,000 per year. The insurance companies reap the benefits because they are able to raise prices annually on their health plans with very limited competition. My business addresses two wicked problems: the high cost for medical insurance and the lack of time the physicians spend with their patients because of in-depth dictations and notes required for each patient. My business model will be a cash-only medical practice that will not accept insurances. The company's name will be Mark and Med. The business is intended to appeal to consumers who do not qualify for the government subsidy or their employer does not provide health insurance. My model simplifies the healthcare market because it offers competitive prices, which means more affordable care. It also offers consumers better quality of care because physicians are not required by the insurance companies to do hours of dictations on their patients. The pricing model and cost of services will also differ from a traditional medical pricing because the consumers paying for the medical services at a cash-only practice understand they are paying out of pocket rather than consumers who have health insurance and see medical costs as using someone else's money. Consumers without health insurance and those with health insurance react differently to price changes. Those covered by health insurance tend to be more price inelastic, while consumers not covered by health insurance tend to be more price elastic, meaning with price changes, their consumption behavior will also change. You will find that medical practices accepting insurances will charge a much higher price for their services. For example, the price of an MRI at an insurance accepted medical practice will on average cost $2,500. The price of an MRI at a cash-only medical practice will be on average between $250 to $500. For the process of ideation when choosing my product, I took into account my interest, major, background, and surroundings. Being an economics major, I have also paid close attention to consumer behavior when it came to healthcare policy. It is overwhelming the amount of scholarly research, papers, and books all claiming to have the answer to how healthcare should be ran. About 2 years ago, I read an article on a medical practice that eliminated insurance providers and offered consumers a cheaper option. This cheaper option was pricing their services cheaper by accepting only cash. For my project, I chose the idea of creating a multi-specialty medical practice that accepts cash only. Services would range from basic primary care appointments to minor outpatient procedures. Each specialty would have multiple physicians whom compete against each other in terms of how much they charge for their services. By allowing the physicians to compete against one another, it ensures that prices will be low and fair. Using critical thinking skills, I was able to identify a problem, create a solution to that problem, and understand the benefits and risks of creating a business to solve a problem. For the ideation process, I wrote down my interests onto paper and then numbered them based on which idea I was most interested in. After deciding that I wanted my project to be based on the healthcare industry, I began to compile data and statistics. I then compared the numbers to other countries and determined the outliers. After determining that healthcare insurance is much higher in the US than other countries, I began to look into annual percent increases in healthcare expenditures. Based on my findings, I thought back to the article I had read 2 years ago where a medical practice had avoided insurance companies and lowered costs. From here, my idea was formed. I spoke to the physicians about the causation behind the annual increases in medical costs and care. I then went on to ask what it would mean if they did not accept insurance and had competing prices with other physicians. Each response was the cost of care would drop drastically because the physician charging the cheapest rate would have all the patients. They went on to say that if their practice did not accept insurance, they would be freed up of dictating which was required by insurance companies and could increase their one-on-one time with the patients. A physician then referred me to a multi-specialty cash-only medical practice in Arizona. I was able to speak to one physician who explained their business model and process. He also explained an interesting perspective in regards to the quality of patient care. He said that physicians under contracts in hospitals are only allowed to spend a certain amount of time with their patients, usually around 7.5 minutes. While his practice, he usually spends up to 50 minutes with a patient in order to provide the best quality of care. The idea of a cash-only medical practice is a great example of lateral thinking because it provides affordable, efficient, and better quality health care without the need of insurance companies and complex healthcare policy dictating who receives a healthcare subsidy and who doesn't. My business idea is solving the problem of high health insurance rates for consumers that do not qualify for a subsidy or their employer does not provide health care. I could solve this problem through a cash-only medical practice that offers consumers a more affordable and better quality healthcare service. The practice would be a multi-specialty and would offer minor outpatient surgeries. The practice uses a free market approach, which allows the physicians to price their services as they see fit. The consumers then dictate whether or not they are willing to pay for that price for their services. Using systems thinking, I was able to create a vision and purpose. I was able to generate the idea, and I was able to create a process. Systems thinking helped me map together all my ideas into one project. I was able to recognize this opportunity by using critical thinking skills. When I chose to focus my project on the healthcare market, I compiled data provided by healthcare providers in order to identify any outliers. I recognized the opportunity by focusing on the constant annual increase in the cost of health insurance. Using a free market approach, I would have low competitive pricing that would appeal to the consumers paying high rates for health insurance. Income would be generated by cash-only patient appointments or monthly subscriptions. The most important resources needed will be physicians. I will also need medical technology and equipment, capital for investment, a building, attorneys, accountants/financial consultants, staff, which includes nurses, office administrator, and receptionists, and then a medical consultant/recruiter. The branding and marketing strategy will focus on telling the consumer that we provide affordable, efficient, and better quality healthcare. We will focus our advertisements to appeal to the consumer who do not qualify for government subsidies or their employer does not provide coverage. Having an interactive and simple website that explains exactly what we do and why will be very important. This venture would be only successful in areas where consumers are willing to pay out of pocket for healthcare. Within the specific demographic, the potential earnings are very high. The true success of the business is left up to the physicians and how they price their services. If a physician prices their services too high, the consumer has to make a choice of either seeing the more expensive physician or the less expensive physician and having money left over. Overall, this course has taught me how to effectively problem solve and how to generate ideas from those problems. In the future, I would suggest that you include a financial aspect for startups.